The vomiting, the diarrhea, the fever. They went through their protocols, notified the hospital that they were bringing in an Ebola patient, and he was immediately isolated when he returned to the hospital on Sunday. They did some tests, and they were confirmed yesterday that this patient is indeed the first patient diagnosed in the United States with Ebola. Ari?
All right, Charles Hadlock, thanks for your reporting from Dallas. For more now, we're going to bring in Dr. Frank Esper, an infectious disease specialist at University Hospital's Case Medical Center out in Cleveland, as well as Ezekiel Emanuel, Chair of Medical Ethics and Health Policy at UPenn. Good day to you both.
Thank you. It's good to be here.
Nice to be here. Zeke, let me start with you. You have said Americans should not be all that concerned right now. Why not?
Well, we shouldn't be concerned that there's going to be a widespread outbreak. We obviously should be concerned for this individual, and we should be concerned that the CDC and the state of Texas do good contact tracing to make sure that no one else has it. But as has been repeated, I think, many times, Ebola is hard to transmit. It's not airborne. It's not like if someone sneezes or you're just talking to them, it's going to spread. That's why I think you heard that, it's just a widespread outbreak is very unlikely to happen, but there are individuals that could get it. The other thing is that in the United States, we do have a very good healthcare infrastructure, and we have a very good public health infrastructure, two things which are totally lacking in Sierra Leone and Liberia. And you can see what even moderately okay healthcare structures do, as in Nigeria and Senegal, that they snuffed out the outbreaks in those countries pretty effectively with very, very few cases being had. So in the United States, we're not likely to see that kind of outbreak.
Dr. Esper, let's talk about this patient in Texas. One of the details that I think a lot of people are concerned about is the fact that he showed up at the hospital. The nurse apparently asked and found out that he was from Africa, and that information wasn't transmitted at that point, so he was sent home, and it was only 2 days later that they brought him in and realized he had Ebola. How does that lack of communication, how does that happen?
That's very, very concerning from a physician's standpoint. We always worry about, missing that one key piece of information that tells you exactly what's going on. And obviously the travel from the west part of Africa, where we see Ebola, is the key piece of information that we look for when we're trying to determine what this patient has. Ebola virus is a virus, and like viruses, they all start very similarly. They have fever, muscle pains, vomiting, diarrhea, and that basically is almost the start of every cold and flu virus, or even some GI viruses, which is what they thought when he first presented. But the travel to or from this part of Africa is the key piece of information that needs to be reported from nurses to physicians to residents to say, hey, we should be thinking about other possibilities, including Ebola.
Yeah, and none of these symptoms had even showed up once he traveled here to the U.S. So, Dr. Esper, if you were at any of the airports that this patient was traveling through or happened to be on the same flight, do you have any reason to be concerned at this moment? And is there anything else these airports could have done? Because they took his temperature, but at that point, obviously, he didn't show any signs of a fever. Yeah, well, that's the problem with Ebola. Incubation period is so long, up to 3 weeks, that you may not have any symptoms, even though you may be carrying the virus, and the virus itself is trying to establish an infection. However, there's a difference between when you are infected with Ebola to when you are contagious with Ebola. And the people who are on the plane, the people who he met or passed by in the airport, are at very little, if zero, risk of obtaining this virus and becoming infected themselves. You really only can become contagious when you have enough virus that has grown in your body and then comes into your secretions, into your the oral secretions, into urine and stool, and then you can only pass it on.
Dr. Emanuel, all this, let's take a more bird's eye view. This entire Ebola situation shows that we need to have a more global view of our health problems. We started this thinking this is something happening over there in Africa that's far away, that's the third world. We don't have to worry about that. But in a globalized world, the problems of failed or fragile states can very easily become our problems.
Yes, and I think it's very important to recognize that this really has gotten out of hand because we have states that have very poor infrastructure. And so we now know, and if we didn't think about it, health problems that start somewhere else can easily become ours, especially if they're infectious agents. HIV started that way. This Ebola is doing that. We know that the same is true with influenza and the flu that usually starts in Southeast Asia and travels. And so from purely the health standpoint, what happens in other countries can directly affect us, and we can see that in this case. And so we do need to keep that in mind. We have a health stake in what happens there, but we also have a national security stake in what happens there. Failed states like Somalia, like Libya now, they are problems for us from a national security standpoint. They're also problems economically, and we cannot afford to see these countries, Liberia and Sierra Leone, fail and become either hotbeds of terrorism or just fail and have a lot of immigrants to other countries and destabilize them. Right. And so both from a health standpoint and a national security standpoint, we have to have an interest, and that's why I think the president is clearly devoting a lot of resources, military as well as financial, and trying to rally the world to that. That's obviously the proper thing to do simply from a humanitarian standpoint, but it's also a proper thing to do from a self-interested standpoint in terms of the United States' health and security. I might also mention that, this lack of communication between the nurse and the doctor in the hospital, and, this is the first time we've heard this problem. This is a systematic problem, and hopefully part of what focusing on electronic health records, focusing on teams, getting people to work better together over the next few years is going to be really important to eliminate these kinds of issues and lack of communication that can lead to lack of proper management of patients. This isn't an isolated case, the only case of bad communication. This is a much more common problem that we really need to get our arms around.
Right, and there's certainly, as you mentioned internationally, there's no off switch if some of these countries have a tipping point and it affects everyone regionally or internationally.
Correct.
Dr. Esper, at the same time, though, as we're reporting on all this, we also have these serious concerns not only about Ebola, but also with another serious illness, the enterovirus, affected now 500 people in 41 states here in the U.S. and the District of Columbia, mostly so far children. Today, we're learning a child in Rhode Island has died from it. So, doctor, when we look at Ebola and the enterovirus and we try to cover this accurately without getting people too scared, what is your view of the risks here in the homeland?
Well, let me tell you right now, as I tell a lot of my patients when I see them, we are born onto an dangerous planet with viruses and bacteria and shark attacks and bear maulings, and these things happen. We need to, what we have been able to do as a society, especially in resource high societies where we are able to really contain, identify, and help people who have these infections and would understand those infections very well. But now, especially with infections, we have to understand it. We just can't think of it from a country point of view. The United States here, but Southeast Asia is over there. We are now, with the interconnectivity of people around the globe, we are all in this together, and we have to understand it. It's why we have to focus our resources to problems elsewhere to help ourselves.
Absolutely, and it's why a lot of people think universal health care is a key part of that, something we're actually going to be discussing later in the show. Dr. Frank Esper and Dr. Emanuel, thank you both. The story isn't going away. We will continue to monitor it and let you know what you need to know about these health issues. Now, next, another big story developing this afternoon. The Israeli Prime Minister, Benjamin Netanyahu, is at the White House. How is the administration responding to that big comparison he made that ISIS is like Hamas in Israel? The cycle rolls on for Wednesday, October 1st.